हाँ हाँ. So, in summary, we can chronic inflammation lead to anemia in three different ways. First, at the iron level. Second, at the EPO receptor level. And finally, at the erythroid precursor level. So, there are three mechanisms involved in the development of ACD. Number 1, failure of erythropoiesis. Number 2, lack of iron for hemoglobin synthesis. Number 3, decreased RBC survival. ACD appear to be primarily related to inflammation and usually develop in the presence of disorder such as chronic infection, malignancy, autoimmune and inflammatory disorder. Inflammatory marker implicated in anemia of chronic inflammation include tumor necrosis, factor alpha 1L, IFN gamma and IL-6. Recently, it has been suggested that hepcidin may be the key mediator in ACD. The hematological abnormality in anemia of chronic disease is an impaired ability to use the iron stored in the reticuloendothelial system. The reason the reticuloendothelial cells do not release iron is not known, but experts speculate that similar to fever, this response aids the body's defense mechanism. Iron that is held in the reticuloendothelial system is not available for bacterial growth, nor is in the iron available for erythropoiesis, which is the similarly between anemia of chronic disease and iron deficiency anemia. The difference, however, is that the iron stores are normal or increased in anemia of chronic disease. Evaluation of the chronic anemia disease. The diagnosis AI or ACD, a healthcare provider order a blood test called complete blood test होना चाहिए उनका and count होने चाहिए CBC include measurement of a person hematocrit percentage of the blood that consists of red blood cells. The CBC also measure the amount of hemoglobin in the blood and can show whatever the person has a lower than normal number of red blood cells. In addition to measuring hematocrit and the hemoglobin, the CBC include two other measurements to show whether a person has enough iron. The ferritin level indicate the amount of iron stored in the body. A ferritin score below 200 nanogram per liter is a sign that person may have iron deficiency. The transferrin saturation TSAT is a score that indicates how much iron is available or calculating to make red blood cell. A TSAT score below 20 is another sign of iron deficiency anemia. A CBC result that show low iron level in the blood yet normal measures of iron stored in the body is a hallmark of ACD. Now we will discuss about the management of the chronic disease anemia. There are two stages of treating anemia of chronic disease. First stage is focus on the treatment of underlying causes, underlying disorder. The second stage is giving recombinant EPO and iron supplement. Treating the underlying disorder is the most important because of anemia is generally mild. Transfusion usually are not required and the recombinant EPO may be offered because both reduced production of and marrow resistance to EPO occur. EPO dose may need to be 150 to 300 unit per kg SC 3 times per week. A good response is likely if after 2 weeks of therapy hemoglobin has increased more than 0.5 gram per deciliter and serum ferritin is less than 400 nanogram per milliliter. Iron supplements are required to ensure an adequate response to EPO. However, careful monitoring of hemoglobin response is needed because of adverse effect. Example, venous thromboembolism (MI) may occur when hemoglobin rises to more than 12 gram per deciliter. Consider erythropoiesis stimulating agent in rheumatoid arthritis and heart failure and cancer. So that is the management of chronic disease anemia. Now we will discuss another topic in next video. So please like and comments to my blog, my video, and subscribe my channel. Okay, good day, bye bye.